Hi, my name is Allison Lebwith, and the special population I chose to do my project on is individuals with asthma. So, what is asthma? Asthma is a chronic or long term condition that intermittently inflames and narrows the airways in one's lungs. Due to this inflammation, the airways swell, and that causes periods of wheezing, coughing, chest tightness, shortness of breath. People who have asthma may experience these symptoms in any range of severity from mild to extremely severe. Some individuals, the symptoms may occur regularly or rarely at all. When the symptoms become overwhelming and uncontrollable, that is what's considered an asthma attack. And as you can see in this picture, it's a picture of the lungs and specifically zooming in on the airways. On the left, it's a normal airway, so you can see how it's totally clear and open and air can go through easily. And then on the right, you can see the airways of the lungs during asthma symptoms, and you can see that it's narrowed, the muscles are tightened, and they look inflamed. So, causes and risk factors of asthma. There's not a specific cause for asthma, as many individuals have it, and there's not one specific thing that is the reason for why individuals get asthma. Often the result is from a strong immune response to an allergen. It can affect people of all ages, but usually starts during childhood. There could be adult onset or late onset asthma, which is, as the names imply, asthma that occurs later in life. Genetics is sometimes the cause of asthma, but many times, since it's due to an allergen in the environment, it varies significantly person to person. Family history, other medical conditions, race, ethnicity, or sex could also be risk factors. There are triggers to asthma, meaning certain things that influence asthma to occur more likely, and those include tobacco smoke, dust, cold air, pollen, exercise, and then also this picture shows some more, which is pets, stress, bugs in the house, cold air, like I said, pollution, basically anything that causes an adverse um, immune response in your inflammatory system. So, treatment for asthma, treatment manages the symptoms but doesn't cure it. And basically, treatment for asthma just allows people to resume to normal activities. So, there's different daily medicines that can be used. These include corticosteroids, which reduce the body's inflammatory response, biological medicines, which target specific parts of the body's response to allergens. They are antibodies used by injection. Leukotriene modifiers. Leukotrienes are cells in your body that are released during an immune response, and they cause airway muscles to tighten. So by these modifiers, it blocks that response. Mast cell stabilizers are a medicine that can help prevent airway inflammation, and inhaled long-acting beta-2 agonists keep airways open by preventing narrowing of them. Then there's also some short-term relief, and that includes an inhaler, which usually has these different chemicals in it, or not necessarily chemicals, but more so ingredients in it. So the inhaled short-acting beta-2 agonists quickly relaxes the tightened muscles around the airways. Corticosteroids, similar to what I just said above, they reduce the body's inflammatory response. And short-acting anticholinergics, they help open airways quickly. And an inhaler is something that is used in short term, but a lot of people use it daily if they feel that their chest is tight and their asthma symptoms are coming on. But this is really important for when we talk about exercise in a little bit. So, exercise induced asthma is basically symptoms of asthma are present during exercise. It's narrowing of the airways in the lungs triggered by strenuous exercise. So, basically, during exercise, it triggers the bronchial narrowing in your lungs in asthma by bringing large volumes of air deep into your chest. So, at rest, the air that enters the lung is warmed and has moisture added to it by the nose, mouth, and throat. but by the time the air reaches the bronchial tubes inside the chest, it's nearly the same temperature and moisture as the walls of the bronchial tubes. So during exercise, the bronchial tubes are called upon to give up warmth and moisture to the incoming air. So they take in more air during exercise and usually breathe more through our mouths when compared to breathing at rest. So this cooling and drying of the bronchial tubes causes the bronchial muscles to contract, which narrows the air passageways and making it difficult to breathe. So the colder and drier the air, the greater stimulus for contraction because there's more of that imbalance between the warm moisture at rest and the cold air coming in when you exercise and are breathing in more. So you can be diagnosed with exercise-induced asthma without a general asthma diagnosis, and about 10% of the general population actually have exercise-induced asthma without general asthma. One thing is that exercise-induced asthma can be confused for simply being out of shape. So I read an article that was actually posted by the Wexner Medical Center, and they said that this is a big issue that they see among a lot of people, and they recommended pulmonary function testing, electrocardiography, echocardiography, allergy testing, or vocal cord testing to help determine whether, unfortunately, you're out of shape or if you actually have exercise-induced asthma in your lungs. So, how to prevent symptoms while exercising? Exercise indoors. And if you're going to be exercising outdoors, for example, if you're a cross-country runner, wearing a mask or scarf is really helpful because cold air can provoke asthma symptoms. Warm up well so that your lungs are used to the extra amount of air coming into your body. Keep an inhaler with you at all times because if you begin to have an asthma attack and you start to panic because your inhaler isn't easily accessible, that stress will heighten the body's immune response and cause the asthma attack to get worse. And, I have warm up properly on there twice. Should you minimize exercise if you have asthma? No. Exercise can help asthma control and improve aerobic fitness. I read an article by Shilpa Dogra titled Regular Physical Activity is Associated with Better Asthma Control in Adults. So the purpose of this was to look at around 7,000 adults with asthma and see through 2 different studies whether physical activity can help their asthma control. So these 7,000 adults with asthma were classified as active, moderately active, or inactive based on self-reported frequency and duration of a variety of physical activities. Asthma control was measured using the number of overnight hospital stays and the number of physician consultations in the previous 12 months. So there was a logistic regression model used to determine the odds ratio for each of the asthma control outcomes using physical activity levels and body mass index as main exposure variables while controlling for outside factors. So during that first part, inactive asthmatics were more likely to have overnight hospital stay and physician consultations than active, and inactive obese asthmatics were 2.35 times more likely to have an overnight hospital stay and 2.76 times more likely to have more than 3 physician consultations within the previous 12 months. There is a second intervention that was conducted with sedentary asthmatics to determine whether regular exercise would lead to improvements in asthma control and aerobic fitness. So this is a 12-week intervention, and participants completed a series of tests to measure asthma control, pulmonary function, and physical fitness. And results showed that asthma control increased among the intervention group and maintained their improvements at the end of the 12-week follow-up, as well as increased aerobic and musculoskeletal fitness. So as the slide says, and as the study shows, that exercise can help your asthma control and improve your aerobic fitness, as well as decrease other negative health effects due to asthma and decrease those hospital stays and physician visits. So basically, exercise is not a cure to asthma because there isn't a cure, but it's something that can definitely help control it. So best exercises for people with asthma. No activity needs to be off limits. However, some may trigger asthma symptoms more. So basically, you just need to know your body well enough to know, okay, what can I do before I work out to prevent my asthma from spiking, and what tools do I have during and after my exercise to help that if something does stimulate my asthma response. So, swimming has been said to be one of the best exercises because the air that you breathe in while swimming is usually warm and moist. And so, the effect of exercise in the bronchial tubes is less, like we talked about a couple slides ago. Cold weather sports and endurance sports may trigger asthma symptoms more. Hiking, yoga, and biking are also known to be good exercises, but basically, you need to, like this picture says, find the sport that suits you. Do whatever makes you happy and what you want to do and what's best for your asthma. And like I said, just having a plan of action is usually what's best for helping asthma symptoms. So, overall, exercising with asthma is extremely attainable. If you, like I said, have a game plan, so you have a proper warm up, you have proper medication, whether you have more severe asthma and you take daily medication, or you just have exercise induced asthma and you have that inhaler ready for if something happens during your exercise, that's really important. And also, knowing how to avoid certain triggers is also really important, just so you know your body and you know how it might respond when you're put in different situations. So this picture here I really liked because it just shows an overall view of what I talked about during my presentation. So this on the upper left, it shows you a picture of different airways with asthma. It shows you on the bottom the symptoms. So that says difficulty breathing, dry cough, chest pain or tightness, night cough, shortness of breath, wheezing. Risk factors, like we talked about, heredity, pollution, infection, dust, certain diet, pets, maybe if you're allergic to them, and treatment. I really like this because it shows that exercising is a treatment of asthma, and it doesn't necessarily harp more on the medication side of it. It also shows no smoking and drinking. I mean, smoking is a huge cause of asthma, but I really like that this picture emphasizes more exercise rather than medication, because I think a lot of times people underestimate the power of exercise, especially on things such as asthma. So that is all I have about asthma and exercise, and basically asthma is very doable and people can be physically fit and live with asthma, and there are simple ways to treat it, such as exercise. So you just need to have a game plan and find what's best for you and your body. Here are my references. And here's my test question. Which of the following is not a way to help prevent exercise-induced asthma? Have an inhaler nearby, skip your warm-up, wear a mask or scarf when outdoors in cold weather, or exercise indoors. Skip warm-up is not a way to help prevent exercise-induced asthma. Like I said, the warm-up is really important because it gets your bronchioles used to the excess air coming into your lungs, and once you start to perform more intense exercise and get into the more challenging parts, then your lungs will not necessarily be 100% adapted to it, but they'll be used to all the extra air coming in and the difference in moisture and volume and also temperature. Thank you.